through this workshop, this regional meeting, through the working with the Africa Group of Negotiators, who I'm really glad are here, Honorable Minister, through getting this agenda, the heads of state assembly of the Africa Union, and this is something we are bringing to the chair of the Africa COVID-19 Commission, President Ramaphosa, to see whether he can take to the Africa Union Assembly in February, that we need to make it a high political agenda, not country by country, but as an entire continent.
I think as Africans, we need to be bold in those discussions and really, but speak more from an evidence angle, speak more from what impacts this is having, but not just talk about the problems. We need to focus on talking about the solutions and defining precisely what it will take to really implement those solutions.
Indeed, for us at Amref, it's not a choice, because working on sustainable health systems in Africa, climate change is going to be the biggest disruptor of the health system sustainability in the continent. So for us, it's not a choice. In our strategy, this is embedded in enabling primary healthcare that's people-led and community-led, people-centered and community-led. And people-centered means all the issues around humanity and people's lives and livelihoods, but also ensuring we address social determinants of health. And one of these is going to be the changes that happen in people's lives because of global warming.
It is evident that the adverse effects of climate change are increasingly impacting our planet, affecting not only the environment, but also the health and well-being of our communities. It is a reality that we are seeing and feeling every day. It is no longer something that we just talk about. Climate change at the global level is now regarded to be the greatest threat to human health.
Therefore, as we go towards COP28, one of the key factors we would like to bring out is that adaptable, flexible, rapid financing mechanisms should address the quick onset and fragile human mobility-related health issues, including the transboundary aspect. It is again exciting to note that today we are going into the discussions as we aim to frame an African unified position on the nexus in health and climate change.
Ladies and gentlemen, allow me to offer a word of gratitude on behalf of the government of Malawi to you all delegates for actually fruitfully contributing to the deliberations. You have been very active and constructive in your inputs and recommendations, and I believe the declaration that has been read out here will be polished, finalized, and then taken further in terms of action by different stakeholders and international institutions.
So there's so many issues which are affecting the health sector, but they're happening because of the impact of climate change. And now we're saying the conversation of climate change should also include the issues of health.
And we feel very strongly with our partners at PACJA, with other agencies such as WHO, with the ministries of health and the government officials, we are committed to work with African negotiators to come up with a common position in ensuring that health is at the center of every climate conversation. Here in Malawi, you have seen the effects of climate on the health of communities, of women, of children.
We have a common position in this meeting, which we are going to advance, and it is a hope that it will get the political acceptance and political will and a drive after that, and then we should see the world changing after we win this position.